Hi, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm here with another segment in our Voices of Innovation series, highlighting the authors that are in the Voices of Innovation AI edition that is coming out very soon. Really excited and happy to be here with these folks. Greg and Casey, do you guys want to introduce yourselves?
Sure. I'm Greg Ator. I am a practicing ENT physician and the recently retired CMIO from KU Health System, and I'm an active user of a bridge, and just excited about the possibilities of working with this technology to improve the experience of practicing docs.
Thanks. Yeah, and I'm Casey Bryson. I'm a self-described rehabbing healthcare CIO, recovering from that lifestyle. But I was very fortunate and grateful for my experiences as a CIO. In fact, that's where I met a bridge as a company, and we deployed a bridge at the University of Kansas Health System in early 2023. And just earlier this year, actually left my position at the University of Kansas Health System and joined a bridge as a vice president of solution consulting and informatics so that I can spend more time giving this technology to providers that need it across the country.
That's amazing. A strong recommendation. Thank you both for taking time out to chat with me. We got connected through the Voices of Innovation AI edition, and I was just curious, did you guys have a connection into that community previously? How did you get hooked up with the Voices of Innovation book?
Well, actually, I think Ed reached out. He was coming through Kansas City, and he wanted to talk to some leaders. And initially, I think the focus was going to be on rev cycle, but I said, I'm appreciative of no margin, no mission, but I'm even more excited about how we can use generative AI to improve the physician experience with documentation to start, and then with so many other somewhat mundane tasks that need to be done to do modern medicine. So I asked Ed if we could participate in the AI volume of the series, and it all worked out. So that's kind of how I got involved with it.
Yeah. And similar, I knew Ed Marks from about 6 years ago. We went to, a team of us went from KU to Cleveland Clinic for the leadership training on site there, and had the privilege of sitting down with Ed and his wife at dinner at the conclusion of training, and we just kept in touch over the years. So when the opportunity came to participate in Voices of Innovation, I absolutely said yes.
Fantastic. So I read through your chapter or your essay with great interest because at Cleveland Clinic we are going through a pilot process to choose a AI scribe for our enterprise, and so a pilot process to both evaluate the technology in general and also to select a vendor if one does emerge. I was really moved by your discussion about partnership as an innovation driver, talking about how you had physician leadership at KUMC and a bridge leadership who were partnering really closely across that pilot. Greg, can you give me your perspective from a physician perspective, and then Casey, can you give me kind of a legal or like a vendor perspective on that part?
Yeah, I think it was a great illustration of the value of partnership within IT and then really across the organization. Casey and I had partnered on a number of informatics and business constructs, and I think Casey actually is the one who discovered a bridge initially, but I was continually on the hunt for things to help our physician experience, both as far as efficiency, but also as far as effectiveness. And I really think one of the things we know from the clickstream data coming out of Epic, that docs spend most of their time, working on documentation, and some folks go late into the night and early the next morning and do that day after day. And so, really, the paradigm of having a conversation with the patient and then going and have another conversation with the computer is just not very efficient. And so COVID, was also we were on the heels of that, and the rapid increase in well, really change, but also increase in things like in-basket traffic and other burdens, uncompensated mostly, that were just intruding on the experience. So it was a great time, and then of course the whole generative AI, open AI LLM, energy hit the market, and so all of those factors kind of led to the possibility of a partnership. And so Casey can tell us a little bit more about that.
Sure. Yeah, so I was shopping for generative AI to produce clinician notes. And a friend of mine actually introduced me to a bridge and said, I want you to take a look at this company and tell me if you think it could be useful and something that you might deploy. And I said, in fact, we're shopping for something like this right now and can't find it. So in terms of innovation, kind of that staying connected and keeping your ear to the ground was really important. Now, when I met a bridge and we started talking about what does this opportunity look like for both of our companies, it was very clear to me that the choice was a bridge when they said, we want to make this a win-win-win arrangement. And that's a win for KU, for our organization. It was a win for our patients and providers, and it was a win for a bridge to develop some go-to-market strategy and integration with large EMRs. So it was that kind of transparency that leads to a full partnership to where we said this is a no-brainer.
Greg, you mentioned something about the data coming out of Epic, and it leads me to another question. When you were trialing Bridge, talk to me about the metrics that you used to measure success. What were you seeing that led you to believe, like, yeah, this is a solution that will really work for us at scale?
Yeah, well, we used kind of a two-pronged approach. Actually, initially we had a kind of a single doc. I don't know. Over the years, I've been doing the informatics system wide. 20 years or so. I don't know how many voice to text demos I've seen, and so we, that past experience kind of. Made me think, hey, let's investigate this. So we had one of our informatics innovation docs use it. He said it was good. Then we got about 20 providers of various specialties, not really, drinking the Kool-Aid of technology, but a wide variety of providers. And we said, hey, let's expand it and let's look at that. And so we did that. And we had an eye to evaluation before we ever, did the first, usage of it. And so we were looking at a Likert scale, a pre-post questionnaire sort of approach. Initially, looking at does this make First of all, do you think it's helping you be a better doctor? Can you be more efficient and effective? Can you get your notes done on time? And then, of course, even delved into that idea of would you want to see more patients? And all things were positive in that initial evaluation, and we took a little pause to see if the company was scaling. We were really the first kind of real customer of a bridge in the Epic environment, and so we wanted to make sure that it would work and that it would scale, and all the factors were positive, and so we subsequently have done a cognitive load study with the NASA TLX tool, and I can tell you about that at some point if interested. But I really think we've seen throughout that it really does work, and it's not perfect, it's not magic. You have to work with it, but there is a role for this sort of capability in a lot of physician practices.
Yeah. Casey, anything to add?
Yeah, I'd say, beyond the project metrics, looking at rolling this solution out to the larger number of providers that Greg talked about, we were looking for a company that listened to our feedback, right? What did those initial providers say, and did it make a difference in how we deployed the technology? Were they on site? Were they coaching us? Were they making sure that we were successful? Did they care? And then ultimately, did they have a vision for the future? And that's where we knew that a bridge was the right partner, when it wasn't just about notes. I've heard Shiv say sometimes it's about conversation to claim and everything in between, and making sure that we're using the best of our ability to really produce efficiency in healthcare and unburden the clinician. So we knew when the interests were aligned and that we had those initial outcomes that Greg talked about from a business standpoint, we were ready to scale the solution.
Yeah, well said. So before I close, is there anything you want to tell me about your chapter, about your digital scribe experience, anything at all that you want to mention that I haven't already asked you?
Well, I have a few things. Again, I think I mentioned that I've seen a lot of these endeavors, and I really think, and there are some parallels from general business, but the fact that we have a physician in the leadership of a bridge, and he's both a good physician, a good technologist, and a good businessman, which I think is an incredible combination. I think that leads to some differentiator sort of decisions that are made, and I think one of the key concepts around generative AI is trust and basically trust and verify. And so the notes allow for the doc to, we no one wants a courtroom transcript, the ums and ahs and, how's the Chiefs doing? We love the Chiefs, but we really don't want that in the notes. So basically the skillful removal of what needs to be removed and then a concise summary. And so on any of the summary that's produced by the system, you can click on phrases, and then the system will give you the evidence that it used to formulate that summary. And so that's a really important, I think, concept, particularly as we push this generative AI model to replace physician activities. We really need our docs to be able to trust that it's not going to leave them, in the lurch and hallucinate and such as that. I think the other aspect that's useful is feedback. To that same kind of point, is being able to give feedback for every note, and then the company respond to that and make sure that the little things that aren't quite working get better and better. So those are two things I think that are kind of one of the same in terms of trust and transparency, but are so important with this technology.
Yeah, absolutely. Casey, anything else you want to add?
Not specific around the chapter, excuse me, or the solution. I just say that when you're preparing to do something new or you want to do something innovative within an organization, it really takes a village and a strong partnership with your leadership, with your vendor partner, and also with your frontline users and mid-level management too. You really have to have this culture of innovation, or if not a culture of innovation, an understanding of the change that is to come, and prepare people for what that change is going to be. Alignment to a strategic objective is all the better. But innovating in a vacuum just doesn't work in healthcare environments, in my opinion and in my experience. So being open and honest with what you're going to accomplish and how you're going to accomplish it, and setting those goals, like we mentioned, and then crushing them is probably the best way to achieve the goal.
Well said. So Greg and Casey's chapter will be in the Voices of Innovation AI edition, which will be coming out, I believe, in March of this year. If you're so inclined, you can purchase it. All the proceeds from the book are going to cancer research, so it supports a good cause. Greg, Casey, thank you so much for making time out to chat with me. This was so delightful. I really
My
appreciate
pleasure.
your time.
Thank you very much.
Thank you.